Today I'm going to talk about the metabolic system in older adults and how the body changes as one ages. I'm going to talk about changes that occur in the body system with aging, the assessment of the body system specifically relating to the metabolic system, the pathophysiology of the disease processes that commonly affect the body system in older adults, and important education that would be necessary to provide for patients or family members related to what is happening to the body when it is going through these changes. Before we get started, there are two terms that I want to make sure you know in order to fully understand what I'm going to be talking about. The first term is aging. According to dictionary.com, aging is the length of time during which a being or thing has existed. So in other words, aging is when one is growing old. The next term I want to review with you is the metabolic system. According to nutritionhub.org, the metabolic system is comprised of several organs, hormones, and enzymes that work together to digest, absorb, process, transport, and excrete the nutrients that are essential to life. So on the next slide, I've included a short video from one of our favorite YouTubers who can quickly explain the metabolic system for you.
Now, the sciencey word metabolism has come to have a meaning in popular speech, but metabolism isn't just one thing. People talk about metabolism as meaning like how fast your body burns the fuel in your food or how high your personal energy level is, and that's fine for use by personal trainers and fitness magazines, but physiologically, metabolism really describes every single biochemical reaction that goes on in your body.
The basal metabolic rate is the rate of how the body uses energy while at rest. In relation to the elderly, we see this metabolic rate decrease. According to PubMed.org, the author here explains why this happens to the elderly population. The muscles in the body are what take up most of one's energy. As a person ages, their muscle mass decreases and their fat tissue increases. The author says, it is shown that the decrease in muscle mass relative to total body may be wholly responsible for the age-related decreases in basal metabolic rate. Since the body is going through physical changes, the energy requirement for an elderly decreases. If a person's body is exceeding the amount of the individual energy needs with the energy intake, then a person will begin to develop fat. When this fat begins to develop, we begin to see other health issues arise, such as glucose tolerance. The author also says that energy metabolism is essential for the physiological functions. Understanding the changes that happen to the metabolic system as one ages, we can now talk about thyroid disease and diabetes. I picked these two diseases to talk about because they are prevalent in the geriatric population and come directly from the metabolic system. As the body ages, the thyroid is affected. Much like how the basal metabolic rate is slowed, the thyroid is also slowed. According to Akbar, who works in the Department of Geriatric Mental Health, he says that thyroid hormone production, metabolism, and action change with aging. This is why hypothyroidism and hyperthyroidism is so prevalent in this elderly population. Hypothyroidism is whenever the thyroid is unable to produce enough of the thyroid hormone. This is where T3 and T4 come into play. Relating to the metabolic system, when everything else in an elderly person's body is slowed, why wouldn't you expect the thyroid to slow too? Hyperthyroidism, however, is when there is an overproduction of the thyroid hormone. This overproduction is normally seen in the younger age group, but can be seen in older people as well. People at an older age are more likely to develop hypothyroidism rather than hyperthyroidism. Again, aging, so think slowing. Not only does the thyroid slow, but we also see the glucose tolerance become affected. In other words, we see diabetes become a problem. When the body ages, the fat begins to develop. Many times, for elderly patients, the fat will begin to develop in the abdomen. When this happens, the glucose tolerance is affected in the way that it breaks down and stores the glucose. This is why many times people become diabetic when they age, but they're not whenever they're younger. The assessment of the metabolic system involves many different parts. We've talked about thyroid disease and what happens to a person's thyroid as they age. So now let's talk about what this would look like if a person were to come in with a thyroid problem. We know that hypothyroidism is when a person is lacking the hormone. The way I like to remember this is that hypo means low. So, when doing an assessment, according to our textbook, you may find heart palpitations, slowed thinking, gait disturbances, fatigue, weakness, or cold intolerance. The difference in older adults in this situation is that you're less likely to see the signs and symptoms of fatigue, weakness, depression, dry skin, weight gain, and muscle cramps, which are all signs that you see of hypothyroidism in younger adults. Now, hyperthyroidism is when there's too much of the hormone being produced. Signs and symptoms, according to our textbook, may be unexplained atrial fibrillation, heart failure, constipation, anorexia, muscle weakness, and other vague complaints. The way I like to remember this is that hyper means that there's a lot and extra. Think, hyper in a child is extra energy. We know that along with thyroid disease, diabetes mellitus is another common disease that we see coming from the metabolic system not functioning properly. So we've discussed what diabetes is, so now we are going to discuss what to look for on an assessment for a patient with diabetes. An assessment on a patient with diabetes looks a little bit different. With this kind of assessment, the nurse should focus on signs and symptoms of possible complications. This would include measuring the patient's blood sugar and watching what the patient is eating. A diet is huge for this kind of patient. Our book says, the nurse begins with the assessment for risk factors for conditions leading to worsening of the diabetes mellitus and the development of complications. In other words, on this type of assessment, just make sure that nothing is getting worse. Diabetes cannot be cured, but it can be managed, and that's our goal here. So the thyroid produces the hormones T3 and T4. These are the hormones that influence the basal metabolic processes and help enhance the oxygen consumption throughout the whole body. The thyroid hormones help control body temperature, heart rate, growth, and weight. In order to see if a person has thyroid disease, they are tested with the TSH serum. Hypothyroidism is a metabolic state in which there is a deficiency in T3 and T4 hormones. According to ncbi.gov, the most common cause of primary hypothyroidism is Hashimoto's disease. Hyperthyroidism is a metabolic state in which there is an excess production of T3 and T4 hormones. According to ncbi.gov, the most common cause of primary hyperthyroidism is Graves' disease, in which this website states is an autoimmune disease characterized by the production of antibodies that activate the TSH receptor, resulting in stimulation of T3 and T4 production and enlargement of the thyroid. Schuyler, a writer in the Diabetes Journal, says type 2 diabetes occurs whenever beta cells fail to secrete sufficient insulin to keep up with demand. We talked earlier about insulin resistance and glucose tolerance developing whenever fat begins to deposit in the body. This occurs because when there is fat buildup at or around the liver and the muscles, the body is unable to produce the correct cells and hormones needed to regulate the insulin levels. The liver becomes less sensitive to the insulin levels, creating the resistance whenever there is fat buildup in the way. When this occurs, glucose tolerance takes place, then throwing the person's blood sugar out of normal ranges. Lastly, I want to talk about education for the family and the patient. Education for the patient and family members is crucial when you are trying to help a patient heal. It is so important to teach the family members of signs and symptoms to watch for and when to notify the doctor if they are present, the medications that they're going to be taking, why they're taking the medications, how often to take the medications, and what to look for if the medication is not working, or side effects from the medication. There are times where including nutrition teaching is important as well, and when to follow up with your healthcare provider. So for hyperthyroidism, IBM Micromedics lists when to call 911 and when to call the healthcare provider. Some of these symptoms to look for include chest pain, seizure activity, fever, chills, or weak and achy feeling, and or if a patient runs out of medication or has stopped taking it. For hyperthyroidism, it is important to educate the patient that they may be sent home with medications such as anti-thyroid medications. These are meds used to decrease thyroid hormone levels and the symptoms that go along with hyperthyroidism. Again, it is important to teach the patient and include the family on taking the medications as directed. Teach the family to help remind the patient when to take their medications and to keep them accountable. Lastly, it is important to make sure the patient has a follow-up appointment with the provider in order to see if the medication regimen is working. For hypothyroidism, it is important, according to IBM Micromedics, to seek treatment immediately if a hypothyroidism patient has diarrhea, tremors, trouble sleeping, or if they feel like their legs, ankles, or feet are swollen. It is important to teach the patient and their family members how to recognize these signs so that treatment is provided if necessary. Like hyperthyroidism, it is important to contact your provider or 911 if other issues begin to arise. The patient will be sent home with thyroid hormone replacement medications, such as levothyroxine. It is important to teach the patient and family about the medications and to make sure the patient sticks to the medication regimen. Education with diabetics will begin immediately. The education will include how to check blood sugar levels, what diabetic medications are, and about nutrition. Diabetics usually have to follow a diet in order to maintain their blood sugar to a healthy and safe level. There are other ways to manage your diabetes, such as checking your feet for sores, wearing medical alert identification, and getting help from family and friends. Since this is a lifelong disease, it is much easier to control when you're having help rather than doing everything on your own. Here I have included a slide with all of my sources and where I pulled my information for this project.